as yeah, as you might have noticed, today's session is recorded. So you are welcome to turn your camera on if you want to, but please keep in mind that it is recorded. So feel free to keep it off if you're more comfortable with that. Please do keep an eye on your mic. Make sure you're muted throughout the session. This will just make it much easier to have a smooth presentation. And as I said at the beginning, for all of those who are joining, we will have first a 45-minute presentation, and then we will have a public Q&A. So when we do switch to the public Q&A, please feel free to ask any questions or comments. You can write them in the chat, and we will try to address most of the ones we can. But also feel free to raise your hand and queue in order to ask your question yourself. But please do wait until you're invited to unmute yourself before you do so. Without further ado, I can pass the word to Charlie, who will be kind of explaining how the presentation will work and start getting into the topic. So I will stop sharing.
Thank you very much, Eleonora. Thank you very much, and good afternoon, everyone. I'm very happy to be here, very excited to have this webinar with Trust. So I will share my screen, and you let me know if that actually works. And here we go. I guess you can see a white screen with a QR code now. So today's presentation would be a bit interactive. I will be asking questions to you so that I can get to know a little bit more about your expectations, your ways of working in relations to the CHS. So if you could connect to that address, wooklab.com, and when you reach that website, it will ask you for an event code that you can enter. So it's the code that you can see on the screen. And then you just have to put your name, basically. And if you do that right now, then we can start off with the presentation, and you will see the questions at some point. I will let you know when they will arrive to your screen so that you can answer them. You can do that on your phone or on a computer. That's up to you. The main presentation will remain on the screen that I share, but you will receive the question on your device. Okay, and if there are issues, just let me know in the chat. How can I perhaps support you with that? Okay, so I'll start with the content of today's presentation, and I will put as well in the chat how to connect to the event code. Yes, I will put the code in the chat right now. Just a second. So it's wooklab.com and the code BZQQGQ. And here you go. Okay. So coming back to the presentation, so today we'll be discussing CHS in evaluations, trying to explore what are the complementarities with the OECD-DAC criteria that I'm sure you already know. So my objective with today's session is really to drive you through the CHS so that we make sure everyone's around the table here and behind the computers actually understand what is the CHS basically, and especially the version that has been revised in 2024. And then we'll dive into the complementarities when using the CHS in evaluation and also the OECD-DAC criteria so that you can see what are the opportunities of using one or the other, what are the limits to some extent of those frameworks, and why there could be complementarities between them. And then I will share with you as well some brief takeaways of how to actually use the CHS in evaluations. But before that, I just wanted to share some information about the organization I'm working for. So I'm working for Group URD. So it's a French-based organization that has been created around 30 years ago. It's defined as a think tank that is specialized in analyzing and improving the practices in the aid sector. So we work with any type of actors that are part of the aid sector. That could be small organization, grassroots organization, community-based organization, but also like international actors, international donors or organizations. And we work in 4 main thematic sectors, which are listed here. So we work mostly on environment and climate change. We also work on nexus, triple nexus, on locally led actions and localizations, and obviously on quality and accountability, which is the topic of today's discussion. As part of that, we are one of the custodians of the copyright holder of the CHS, one of the 3 with CHS Alliance and Sphere. And as part of our activities, so we are working on different type of activities. So we provide strategic support. We do studies and researches. We do evaluations as well, project evaluation and program evaluation. We developed some tools and methods for the humanitarian sector, and also provide organizational support. And all these activities are actually applied on 4 thematic sectors that you can see up above. So this would be the first question of today in terms of interaction. So you can see that question in your device if you connected. Otherwise, you can still connect by going to booklab.com and entering the code. And that first question is actually, who among the attendants already consulted the CHS 2024 version, so the revised version that has been launched earlier this year? And that's an opportunity as well to check if everyone has access to the booklab. Okay, so for now, majority of you already consulted the 2024 CHS, which is great. That will ease the conversation. I just wait for a few seconds for the others to connect and to answer the question. Okay, so 60% of you already consulted the CHS 2024 version. That's great. That means that there are still people that who don't know about the CHS, the revised version, which is fine. That's why we'll go into the content bit by bit, and feel free to ask your questions as well in the chat. I will try to have a look. The other question is, how familiar are you with the CHS? It's one thing to know about the CHS, but using it on a daily basis and being familiar with that framework is something different. So I just want to have an understanding of how you use the CHS and how familiar you are with that framework from a global perspective. So yeah, it's quite mixed. It's perfectly mixed, actually, 25% for each one of the response. Okay, so some of you are very familiar, which is great. Some others don't know much about it, which is also perfectly fine. That's great. I assumed that the audience would be mixed, and now I have the confirmation of that. So that's perfectly fine and great. So entering the first part of the presentation, the CHS. So that standard, which is a quality and accountability standard that is an internationally recognized and used standard, has been first being published in 2014. So now it's been more than 10 years that it's out. It's available in 33 languages. So you can imagine that there are many, many local languages that are included, not only the main international languages, which is very much important if we want a clear uptake of the CHS in many contexts. As I said, there are 3 custodians, or we call them also copyright holders: CHS Alliance, Sphere, and Group URD. That's what makes specific about that standard, about quality and accountability, is that it's all done with people being at the center. And that's very, very much important in the CHS. It's built around the visions of people and communities and what they can expect from organizations in terms of quality and accountability, so that the interventions are transparent and respectful. It's built actually on the Sphere humanitarian chapter, on the humanitarian principles. So that's very much rooted into those international framework. And it looks like a flower, as you've seen already, and as you can see on the logo, which details 9 commitments that are made by organizations to people and communities in situation of crisis and vulnerability. So it's really like a commitment that is a general commitment that is made by organization to make sure that we work in a qualitative way, in a respectful way, in a transparent way to deliver assistance to people. It's currently being used by 173 organizations worldwide in more than 50 countries. And as I said, it's used by small organization and also big, large international organization. There is no specificity around that. And that's something that we are really willing to keep like that. And it's also voluntary. You don't necessarily have to register to the CHS. You don't have to be certified. You don't have to be verified against the CHS to be able to use it. And that's very much important as well. Everyone can use it as long as it's part of the way, like the assistance you provide to people. Just a word about the uptake of the CHS, because it's been used through very different frameworks and documents in the sector. You can see some examples here, but basically it's used as a background for the YASC commitments on AAP and for the AAP framework. It's also referenced in OCHA strategic plan. It's also part of the UN agencies, policies and guidance, and it's referenced under quality and accountability standard for them. And it's also mentioned under the Green Bargain Revolution in participation more specifically. So just to let you see how the CHS is actually being used worldwide by international organizations. But as I said, it's also been used on a daily basis by smaller organizations on many different countries. So it's not only for international organizations at all. Few words about the revision because it's an important process and that leads us to the actual CHS, the 2024 version. So that consultation started in 2022. So you can see that the CHS was launched in 2014 and the revision started in 2022. So during 8 years, the CHS was used in its previous version. And in 2022, we decided to revise the standard because the sector has changed, because the context of operations has changed, because the actors also have changed and their needs as well changed. So we decided to do that worldwide consultation that would lead eventually to the revision of the CHS that has been launched in 2024, beginning of that year. And that consultation was done with 6 objectives. The 6 objectives were to reinforce the standard as people-centered framework, to address some priority issues that are affecting quality and accountability in the sector, and that obviously changed between 2014 and 2022, to try to make it even more clear, simple, accessible, so that much more actors could actually use it on their work. And that's related to another objective that we can see later on. We wanted as well to reinforce the measurability of that standard because it's a voluntary standard, but it's also used for certification and verification processes. So we wanted to make sure that despite the revision, we still can measure performance against the standard for organization. And we also wanted to make sure that there is kind of a coherence and no overlapping between the CHS and other international standards on quality and accountability that are already being used. So that overall, that standard is used by more actors. And that's the effective ultimate objective, is to make sure that it's here, it's there, it's free, it's voluntary, and many different actors could actually use and apply it in their daily work. So that's just for you to understand why we did that revision. And so to conduct that revision, so we did a consultation overall in more than 90 countries, more than 4,000 individual people, individual contributors actually provided inputs into the revision process. And among those people, 500 were actually community representatives, which is quite a significant number. And what is interesting is that we discuss with those community representatives, and actually what they say to us is that the commitments actually refer what they want to see in terms of good quality and accountability in organizations' ways of working. And the issue is much more related to the effective implementation of those commitments, but the way they are designed, the way they are framed, is actually reflecting most generally their concerns. And that was done through a series of workshops, online consultation, focus group discussions. There were bilateral and multilateral meetings that were hosted by the steering group, the management group, and the writing group, who were the three main components who conducted that revision. And myself, I was part of the management group and the writing group who actually contributed to that revision. So what has changed in the end? Obviously, we reached most of our objective with obviously different perspective on each one of the objectives. But what we can see in the end is that people are even more clearly at the center of quality and accountability efforts. And I will come back to that later. The structure of the standard is actually simpler to understand, easier to use. The wording is much more accessible, which was very much important. And in the end, that makes the standard more accessible to more organizations and more people in the world, which obviously is really something we wanted. In terms of visual, we moved from a green flower to a blue flower, but in the end, you can see that the visual remains more or less the same, although it's perhaps more accessible, less wordy, but the structure overall remains the same. And now what I suggest is that we go into the detail of the commitment so that you can see what the changes are in detail, compared between 2014 and 2024. So in 2014, we had 1 and 2 commitments that were about appropriateness and relevance, the second one being about timeliness and effectiveness. Through the revision, what we saw is that you cannot necessarily separate appropriateness, relevance, and timeliness and effectiveness. When you speak about effectiveness of aid, effectiveness is about making sure that the assistance is provided on time, that is addressing effective needs, and that it's actually provided in an effective manner. And all that goes together. So it's difficult to separate those concepts, which is why we decided to reunite them and merge them into one single commitment so that it's clearer, simpler, and stronger in terms of narrative. So that's why we decided to merge those two into a single commitment. We used to have a commitment on resilience and do no harm, which was commitment 3. Now we have 2 separate commitments that are covering those concepts. Why is that? Basically, resilience, building resilience, and making sure that we don't harm people and their environment are actually kind of different concepts that are linked to each other, but are very important. And the suggestion that we gathered through the consultation was to actually differentiate those components and make 2 separate commitments so that we give each one of the components its own importance, its weight in the CHS as a whole, and that we can go into more detail as well on the different elements around preparedness that was not part of CHS in 2014, to reinforce preparedness in relations to resilience and local leadership. So that gives more weight to that aspect of the work. And do no harm is now a separate commitment as well, with focus put on people and their environment, which was not the case in 24 again. And the commitment 4 is still there, but it has been moved up to commitment 1. And this is more symbolic and visual because all the commitments are important. There is no order, but when you read the CHS, obviously you would start with commitment 1. By starting with participation, diversity, gender inclusion, you make sure that this is in your mind throughout the reading of the rest of the commitment. And that's very much reaffirming that people, communities, participation is at the center of all intervention, which is why we decided to move it ahead in commitment 1. But the content remains more or less the same. For the rest, the content is again quite similar between 2014 and 2024. Although wording changed, some elements were added. It has been made much more simpler, straightforward, and accessible, but the content and the concepts behind remain more or less the same in between the previews and the actual version of the CHS. So if you look into the details, you will recognize easily the requirements that are inside each one of the commitments. And that's how we end up with that final flower. Final word about the CHS, and I will dive into OECD-DAC criteria and complementarities with the CHS right after. We have a standard, which is the CHS, which is great, but a standard is not necessarily easy to actually put in motion, to put in practice, to implement. That's why we defined in 2018 what we call the Quality and Accountability Compass, which is the operational guidance linked to the CHS to actually implement projects, to fund projects, to improve on a continuous process, any project, and to evaluate the project. And I will be using elements from the Quality Compass in that presentation because it's very much focusing on how to use the CHS in different aspects of the work, including evaluation. The Quality Compass has been done by the Group URD in 2018 and is now being under revision, following the revision of the CHS. But the content is still quite interesting and useful, even though the CHS evolved a little bit. So you will see, I will show you some elements extracted from the compass. Okay, so now we'll dive into CHS and OECD-DAC criteria, trying to look at what are the criteria and the related guidance, what are the limits and opportunities of using different frameworks. And before that, I will ask you another question on WooClap. So get your devices ready, open your tab on your computer. And here comes the question, which is kind of a quiz for you. No, not this one, the one right after before, sorry. So what framework do you actually use most of the time for evaluations? Is it like OECD-DAC criteria, other broad normative frameworks such as the humanitarian principles or conventions on the rights of the child, of the children, the CHS perhaps that you already use, your own internal framework that could be used as well for evaluations? Is it like a sectorial standard such as the minimum standards for education in emergencies or other related to WASH, food security, any other sector? Or perhaps local standards that are related to your local context. Okay, so a vast majority of you are actually using the OECD-DAC criteria. 1% already used the CHS, interestingly, and others, yes, use their own internal framework, which definitely makes sense, obviously, when it comes to evaluation as part of an organization. Okay, so around 68–70% of you are using apparently the OECD-DAC criteria. We'll see right after some tentative figures about how it looks like in the sector as a whole. It's not perfect, but it's just to give you as well a general understanding of how the DAC criteria are used.
Maybe just one question that
Yes.
can also help like orientate people who maybe are not such expert practitioners, which can be used to contextualize, is why choosing the right framework like between all of these for evaluation matters so much, and when maybe is it supposed to happen in the evaluation process?
Thank you. So it's an important question because we are speaking here about evaluation frameworks, but obviously there is a question of why is it so important that we select the right evaluation framework, and when that happens. It actually happens in the very first steps of the evaluation, which obviously is linked to the period of time when you are drafting your terms of references, or when you are thinking about the questions that you will put in the evaluation. And actually, that graph shows very well the importance of defining the questions and selecting the right evaluation framework in your evaluation process. And what you can see on that graph is that the very first stages, and you can see evaluation questions here, are having the higher influence over the quality of the overall evaluation. So those stages of thinking about the scope of the evaluation, thinking about your general approach, whether it would be a programmatic or a project or a mixed evaluation focusing on different components, or a sectorial evaluation, whatever. So that general scope of work, whether it's an interim or final evaluation, whether it's an impact evaluation, so that general scope is very important, and that drives the rest of the work. But right after that, it's actually the selection of evaluation questions, and linked to the questions, what are the evaluation criteria that you are using. And that goes together because you can get inspiration from the evaluation framework and the quality criteria. And you can also draft your questions and then relate them to the criteria. But overall, that stage of finding the right questions and the right evaluation framework is having a huge impact on the quality of the evaluation, which is why it's super important to carefully think about that in the evaluation process, and not later on. Otherwise, yeah, it's a bit late. I have a quick quiz for you before going into the detail of the OECD-DAC criteria. Which among all these criteria are actually the one defined by OECD-DAC? So obviously there are good and wrong answers. You can select several criteria. Some of them are the one from OECD, but not all of them. Okay. So there seems to be a consensus on relevance, but that's actually the only one that everyone is picking. Otherwise, others is a bit mixed. And no one is picking coverage and coordination. Oh, no, it's changed actually. Okay, interesting. So you can see that there are a lot of very good evaluation criteria, because all of them that we can see on the screen are actually good evaluation criteria. There is no question about that. But some of them are OECD-DAC, others are not necessarily linked to that framework, which doesn't mean they cannot be used, which doesn't mean that they don't make sense. It's just that they are different from that framework. And sometimes we get mixed between what is actually in the OECD-DAC and what is not. And that's what I want to show to you right after. Okay, so the 6 OECD-DAC criteria are actually those ones: relevance, effectiveness, impact, coherence, and efficiency, and sustainability. So there are 6 criteria that are defined by OECD-DAC criteria, and they are not more than that. All the others criteria are actually kind of linked to the OECD-DAC criteria, but they are expanded mostly by ANAP through the guidance that they provided around the use of the OECD-DAC criteria. They can be suggested by some organization, and now they are being used by many organizations, but they are not per se part of the OECD-DAC criteria. So it's just to show you that even though we don't necessarily know about it, we are already using different frameworks There are a lot of evaluations that are using coverage or coordination or participation and relevance, effectiveness, impact, and others. And we are already mixing different frameworks and using different criteria inspired from different frameworks. So that's important to keep in mind. What I wanted as well to emphasize and to put the focus on is that the criteria by themselves don't say much. It's just one word. One word can be interpreted in many different ways. That's why it's very much important as well when you use these criteria to actually refer to the guidance that is provided around those criteria. And there are guidances that are given by OECD and ALNAP also, who define very interesting guidance. You can see the list here. Sorry. And actually, those guidance are very much important to actually be in a good position of interpreting the criteria in the right manner and be in a position of applying them meaningfully and thoughtfully. If you just use the word itself, you can use it many different ways, but there are a lot of concepts behind, a lot of ways of interpreting it, and those guidance are helping you to actually do that in an interesting and thoughtfully manner. So you can see, and I definitely encourage you to have a look at the different guidance here. If relevant, we can also share the link to all this afterwards. They are not, I mean, they are public, they are on the website. What's important to understand as well is that the ALNAP revision of 2023 of their guidance for evaluation is actually including the CHS as a potential reference for evaluation. For the first time, they are not only talking about OECD-DAC criteria, but they are incorporating the CHS as another relevant framework for evaluation. And they are actually comparing some of the criteria from OECD-DAC with the CHS commitments, because as you will see later on, some of them are very much connected and some others are kind of different. So encourage you to have a look at those documents. They are quite insightful. To keep in mind, as I was saying, the majority of the evaluations today use the OECD-DAC criteria. There is no good figures about it. So I asked our friend ChatGPT to give me a figure just to see what comes out from its analysis. And what he told me is like 70 to 90%, which is quite broad, but still that gives a kind of an understanding of how many evaluations in the sector are actually using the OECD-DAC criteria. I wouldn't say that figure is actually true, but that's one way of looking at it. And I guess it's showing part of the truth, which is actually a majority of evaluation are using that criteria. And that's what we could see in the small survey we did together in 5 minutes. Obviously, there are very good reasons to use the OECD-DAC criteria because if we apply a standard and a framework consistently in many different evaluations, that would help what we called meta-evaluation. So like it's a evaluation of evaluations, drawing lessons from a wide range of evaluations. And obviously, if you have the same criteria that are coming again and again in all your evaluation corpus, you can more easily at least analyze what comes out on relevance. What are the main issues when it comes to relevance? What are the main issues when it comes to sustainability, and so on and so on. So that's a good point for using the OECD-DAC criteria. The good thing as well is that using standard criteria is more likely to capture common weaknesses in humanitarian action because it's applied consistently. You can have a look at those weaknesses consistently as well, based on experience, based on research and evaluations. And it's also easier to work with for evaluators, for managers, for people who interact with the evaluation. It's easier to understand because when you talk about relevance, people immediately understand what it is. At least they get the concept, they get what's behind because they already used it in other works. So that's really relevant in terms of why we should use that OECD-DAC criteria. for sure. Then the question is, if it's useful for evaluation, why we should use another framework? And that leads to the other question of what are the limits to the use of those criteria, because there are some limits. And this obviously is open to discussion. It's just my vision of how to use those criteria. First is that not only my vision, actually, it's mine, and also based on the literature and from ANAP as well perspective. First is that, as I mentioned, so the criteria themselves is just one word. So it's not necessarily easy to understand, to grasp, and to get all the meaning that is behind. And they are linked to two essential principles that are often overlooked. And that's what the literature is saying as well. Those two principles are making sure that they applied thoughtfully and in a contextualized manner. So relevance is in one context is not necessarily the same thing as relevance in another context. And you can think about two different contexts, like, for example, a Ukraine today, and you can take like Cambodia, which is completely different, different momentum of crisis, different context, different needs. Obviously, what is relevant for one stakeholder in Ukraine is not necessarily relevant for another stakeholder in Cambodia. So this, for example, is suggest to interpretation. And the other principle that is very much important is that we should use the context, the criteria, depending on the purpose of the evaluation. All evaluations are not necessarily supposed to cover all 6 OECD-DAC criteria. We should focus on what is important for us, depending on the objective of the evaluation, whether it's an evaluation that is made for accountability only, or if it's made for learning purpose. Most of the time we are kind of in between accountability and learning objectives. So it's important that we define what is the balance and to apply the right criteria and the right questions, depending on the purpose as well of our evaluation. So that's one thing. And I've heard many times that people don't necessarily know how to use the criteria, so they put all 6 criteria, and that's easier. They don't have to think about whether relevance makes more sense than impact, or no. They just pick the 6 criteria, which is not necessarily a good way of proceeding. As I said already, one word could suggest multiple interpretations, and that's very much important when it comes to OECD-DAC criteria. One single word is very difficult to interpret, and if you ask one person, that he probably would give you a different interpretation than another one. So that's very much important as well, to apply thoughtfully and not in a mechanistic way, in a sense that we just copy and paste and use the same criteria over and over. We have to apply thoughtfully and in a contextual manner. Interestingly, we can argue as well that the OECD criteria is actually not addressing the power imbalances. So you would say that it's not the purpose of the criteria. Yes, obviously. But when you use the criteria, you always kind of carry all the weight with it in terms of how you use it, how you interpret it, how your evaluation is actually integrating those criteria. And actually, when you look at the guidance around OECD-DAC criteria, it doesn't specify who should be defining the concepts. And if we are international organizations that is supervising the evaluation, obviously, and most likely, we will carry on our own vision of what means relevance or what means impact or sustainability. And that's actually carrying the same issues around power imbalance, because the visions that are represented through the evaluations are not necessarily the one from populations, from communities, from people that are on the ground and that are receiving the assistance, let's say. And you will see that the CHS is actually showing a whole different perspective on that. Yes, we talk about the top-down application slightly. What's interesting and what I mean behind that is that when you look at the OECD-DAC criteria again, you can feel that what is much more valorized is actually performance over processes. So you would much more look at what you actually reached in terms of impact, in terms of sustainability of the impact, in terms of effectiveness of the assistance and so on, but not necessarily about how the project actually was implemented and what are the experiences of the stakeholders throughout the project implementation. What about participation? What about the quality of relationship between stakeholders? What about the complementarity between the stakeholders and the locally led actions? So those elements are not necessarily the ones that are popping up when you look at the criteria and when you are using them, although that's an important part of humanitarian work. And obviously, we say that already there are some missing aspects that are not covered by the OECD-DAC criteria that could be covered by other frameworks as well. So a global recommendation would be, as I mentioned several times, to apply the OECD-DAC criteria thoughtfully, using the guidance that is linked to it, to make sure that they are contextualized, carefully selected, and not applied in a mechanistic way. These are the top takeaways to keep in mind when speaking about using those criteria. In terms of gaps, so there was a review done in 2023 by ALNAP, which shed light on some elements that were not well covered by the DAC criteria. And actually what they did is that they review a corpus of evaluations, more than 40 evaluations, and they were trying to look at what were the actual criteria that were evaluated in those documents. And they identified some gaps that actually are not reflected in the criteria, but that are very often evaluated. And that's the case for gender, diversity and inclusion, equity and equality. Those elements were seen many times in many different evaluations, and they are not well captured by the OECD-DAC criteria. So again, that's just showing you how important thinking outside of the OECD-DAC criteria is, and how important the complementarity between different frameworks is to make sure that we reflect on the actual issues that we need to evaluate. So that's the report that I encourage you to have a look at. And they also shed light on AAP, participation, communication. In 40 evaluations they analyzed, these came out 19 times. So around 50% of the evaluation actually explored issues around AAP participation and communication, but that's not necessarily covered by the OECD-DAC criteria, which raises the question of how to frame the question and how to get inspiration and where to look for inspiration. Protection, again, was also something that was seen as missing. Adaptive management, and also everything related to localization, ways of working with local national actors. So all these elements are essential to today's sector, but they are not necessarily well covered by the OECD-DAC criteria, which give us good reason actually to use the CHS, because they are covering some of these aspects. So we can, for example, see that the CHS is very much a people-centered framework, people-centered standard. So that makes your evaluation as well very much people-centered. If you use the commitments of the CHS, they always start with people and communities in situation of crisis and vulnerability. So everything that you will evaluate and measure will have to be evaluated and measured through their perspective and not necessarily from our perspective. So in terms of who should interpret the criteria, the questions, and who gives their views, it's very clear that people and communities are at the center of that initiative. that increases as well 360 degrees accountability. So that's again to strengthen the fact that evaluation is not only for donors, it's not only for upward accountability, as we say sometimes, but it's increasing what we call the 360 degrees accountability towards all the stakeholders around the project, and making sure that people are at the center of our work, including the evaluations. It's strongly connected to humanitarian context and principles, which also is the case for OECD-DAC criteria because they have a specific guidance for emergency context, but CHS has been designed for emergency context, humanitarian context since the very beginning. So that gives a lot of coherence between actors as well, working in that sector. There is a strong integration in the CHS of some cross-cutting components such as environment, gender, inclusion, protection against sexual exploitation, abuse, and harassment, which obviously is very important, as we could see in the gaps identified by ALNAP. It's covering some complementary aspects that are not covered by the DAC criteria, such as participation and feedback, learning and improvement, staff support, strengthen local capacities, avoiding negative effects, do no harm, and so on, which are very clear in the list of commitments. And interestingly as well, for those organizations who are already working with the CHS in terms of verification or in the frame of their monitoring and evaluation processes, that reinforces as well the coherence between evaluation and other international ways of working, procedures, and so on. So I guess if some of you are already working with the CHS, that makes sense as well to investigate a bit more on how to use that for evaluation. And final point is that I guess you've seen that the CHS is not framed as one word as the OECD-DAC criteria is. So we don't speak about relevance.
Sure, be saying whatever you like, Kokombi.
So we are having like a complete sentence, which is more difficult to keep in mind, to remember. I can agree with that, but that also gives more detailed, specific formulations on how to interpret the different commitments and how that could support the draft of the question and facilitate the understanding. So it's both a strength and a weakness, let's say. And we can see different ways, but in terms of evaluation, at least it's helping to frame the questions and to understand the concepts behind. Definitely.
Thank you so much. I think this analysis was so interesting and deep in analyzing these different tensions. But this, keeping in mind all this, is CHS something that is supposed to totally substitute, or can we totally disregard OECD when we evaluate projects? Or what is the balance that can be found between these gaps and positive aspects of CHS?
So as you understood, my point is not necessarily to say CHS is the only one that we should use or OECD-DAC criteria is best. All criteria have strengths and weaknesses. What I'm saying, I guess, is more that there is no opposition between the two frameworks, but there are a lot of potential for complementarities that we shouldn't disregard one or the other, but look into various frameworks where that makes sense for our evaluations. And it's all like, I'm quoting OECD here, but they are saying in one of their documents that the evaluations could definitely use several reference framework, meaning that you shouldn't use only the OECD-DAC criteria, but you can look in other frameworks for that.
Thank you. And building on that, something that also was raised in the registration form and I think could be relevant is to think of examples where CHS is being used, and also whether there is an idea of if we can think about integrating CHS and OECD in a single framework or evaluation. Is this something that has been thought about?
Yeah. No, definitely. So it's difficult for us to keep track of all the evaluations that are done using the CHS because, as I said, it's voluntary, it's there, it's public, and we don't necessarily review all evaluations. So we don't have a quantitative estimation of like how many use the CHS or not. We know that there are some evaluations that are using them. What we can see as well is that some organizations develop their own blended criteria, their own internal framework using both CHS and OECD-DAC. And that's the case for at least two of them, World Vision International and Handicap International, Humanity and Inclusion, which both define an internal framework for evaluation based on criteria that are inspired from those two general frameworks. So that's definitely possible, and that's great actually, because they take the best out of each one of the frameworks to define it. We have reported usage as well from some organization, namely the Disasters Emergency Committee, who use that in their real-time learning exercises. We have reported usage of CHS in several evaluations, and we as Group URD as well, doing evaluations, are also using the CHS to frame our evaluation. And I wanted to show you something right before going into the last part of the presentation, is the correspondence table between CHS and OECD-DAC criteria. And that's a very useful table to visually understand where there are complementarities, where there are potential, not overlapping, but close correspondence, let's say, the green cells, where you can say that, yes, OECD, DAC, and CHS are very much aligned. And that's the case for some of the commitments. For other commitments, the correspondence is more relative, not necessarily straightforward and easy to get. You can find elements that are corresponding to each other, but they are not perfectly aligned, obviously. And that's where the complementarities happen. That's where there are room for using both frameworks. We could say, for example, if you want to look at relevance or effectiveness, you can use that commitment. You can use commitment 2. That is perhaps more or less the same. That wouldn't impact that much your evaluation and the way you frame your questions and so on. But if you look at others, for example, commitment 4 about making sure that the assistance doesn't cause harm to people and environment, here it's much more difficult to find a close correspondence with the OECD-DAC criteria. So if you were to look into that aspects of your work in the evaluation, you can definitely get inspiration from the CHS because it's focusing on that aspect, whereas the OECD-DAC is covering it, but much more from distance, let's say. And this is something as well I can also circulate. It's an internal document from Group URD, but it's, yeah, I mean, it's here if it's helpful for you. The final part of the presentation, and it will be very short, is how to use the CHS in evaluation from a practical perspective. And I just want to give you 2 key takeaways from the Quality Compass that I think could be very relevant and explaining you how to use the compass. The first takeaway is inspired from the preliminary phase of your evaluation process. So preliminary phase is when you actually think about what to evaluate, how to conduct your evaluation. So coming back to the graph with the different stages, that are the very first stage of defining the scope, defining the approach, and defining what to look at, what is the area of inquiry. The CHS and the compass can help you in that stage to actually quickly identify what are your strengths and what are your weaknesses and what to put the focus on for the evaluation. And for that, you can use what we define as the CHS health check. So that's a simple tool which looks like this, based around the CHS commitments with like easy assumptions to fill that will help you to have a global understanding of what are your areas of strengths and weaknesses. And perhaps that can help you as well to understand where your evaluation should go, what is the area on which you should focus to actually get into more detail and get recommendations about what is perhaps not working. So that's an interesting way of, defining the best questions and the best criteria using the CHS as a reference. And that's part of the quality compass. The second takeaway I wanted to show is actually for the next stage of preparing your questions. And that's very much helpful. So it's found in the quality compass. For each commitment of the CHS, you have a one-pager like this, in which you can find what is the commitment saying about evaluation and how you can interpret it in an evaluation context. Then you have a set of proposed evaluation questions so that it helps you to define your questions. And finally, some areas for analysis and recommendations that you can look at. And you can have that for each one of the commitments. So that's helping you again to define your question and to define the general scope of your evaluation. That triggers then the quality of your work afterwards. And I'll stop there. I have lots of different other stuff to show you, but I'm happy to share resources afterwards, and we'll take some questions. Thank you very much.
Thank you so much. This was incredible. Also, Umesh in the chat appreciated the presentation. It was very useful. So while I invite everyone to write your questions in the chat or raise your hand through Zoom to queue up to ask questions, just some technical questions that were raised in the chat. Yes, if Charlie consents to it, but I think it's no problem to share the presentation and recording after the meeting ends. Also, on one point that that you raised, I think when you were talking about the revision process, it was asked how you define the community representatives to better understand how this process worked.
So, sorry, repeat the question again. I was looking at the chat as well. Sorry.
The question, no worries. The question is, how do you define the community representatives? And this was raised when you were talking about the revision process.
Okay.
Yeah.
So what we did actually, so the community representatives were mostly in some countries of Africa. They are not, unfortunately, we wanted to have much more community representative in much more countries, but from a resource perspective and from a practicality perspective, we couldn't do it in all the countries we wanted. But we worked with local consultants who actually went into locations where there were people displaced, so mostly IDPs for example, in Mali, in Niger, in Chad, where they actually went to meet community representatives, which are not necessarily representative in the sense that they are officially elected or part of a special committee. They are just people from communities who can speak on behalf of their perspective, what they live as people who are receiving assistance on a regular basis. And that's what we wanted. The only criteria that we had is to make sure that we talk with people who are actually those who are receiving the assistance and in a position to say, this is what I want from an organization who is coming to my location. This is what I expect from them in terms of quality and accountability. This is how I expect them to work, to behave, and so on and so on. So that's how basically it was done through focus group discussions and observations as well. And those consultants were people from the country, so they could engage easily with the people in the field and reflect upon their visions. And they were piloted as well with us, with the management group and the revision group, so that we make sure they actually cover the areas of inquiry of the revision, so that they understand the objectives behind. So all this was done kind of together, but they were the one on the field.
Great, thank you. And Henok, the person who asked this question, if you need any clarification, feel free to use the chat. But I think this was a very extensive answer. Another question that was raised is how is the use of CHS for project evaluation different from the CHS Alliance self-assessment?
Yes. So CHS Alliance is part of the copyright holders, of the 3 copyright holders, and they have a specific mandate on the verification processes, generally speaking. So they are the one who are holding the verification process, the certification process, and the external audits and so on. So they are in charge of, and also the self-assessment, because self-assessment is part of the verification processes around the CHS. And it's the, let's say, it's the cheapest one because obviously you don't have to pay for that. The other one, there is kind of a price for getting into the verification process. Self-assessment is kind of the first stage that you could enter to evaluate, to measure to which extent your organization is performing against the CHS commitment. So this is very different from using the CHS in evaluation, in project evaluations. On one hand, you have the CHS self-assessment that is actually looking at how you are performing in terms of ways of working in general. And using the CHS in evaluation is actually using the CHS as a framework to evaluate the performance of the work on the field from any organization. Then if you ask the question of the correspondence between the self-assessment and the CHS health check that I showed you, these could be kind of they could be linked to each other. The only difference is that the self-assessment is very much thorough, very much complex, much longer to apply because it's applied consistently throughout the organization. You have to conduct several workshops and to look at many different documents, whereas the CHS health check is very operational, very light to use. You can feel it within 2 hours with your team and you get a good sense of what are your strengths and weaknesses. So it's much more operational than the self-assessment, which is much more organizational, let's say. And I hope I'm making it clear and not confused anymore.
Thank you so much. Just since some people are thanking and leaving, I wanted to say thank you all for joining. If you have to leave, feel free. We're going to stay a bit longer to address some more questions. But yeah, for those that are leaving, thank you for joining. I will just pick one question from the chat that came before Michael, before you raised your hand, and then we can come to you. So Kamal asked, what about the challenges related to some local contexts where most local implementing partners are not aware of CHS? So how is it important to provide them with some awareness sessions before starting the evaluation, or is this not mandatory or important?
That's a very good question. And I would say that, yes, obviously that's very much important. Like a good way of implementing evaluations is obviously to involve the communities into the process, into the definition of the questions, into the validation of what would the evaluation would look at. So yes, definitely. If you're in a position of explaining, showing a little bit about the CHS to the communities, that's great. But I would say that it's not necessarily the most important to know about the CHS to actually understand what are the issues and how to design your evaluation. What makes sense first is actually to have a good understanding of what you want to actually look at in your evaluation from a global perspective. What are the issues? What are the areas of concern? And then you would draft your questions and get inspiration from some of the frameworks. Obviously, if you introduce the CHS beforehand, people obviously would tend to relate to that framework, to think about the question, to think about the issues. So that definitely makes sense because it will be a people-centered definition of question, people-centered evaluation. So it's great if you have the opportunity to introduce the CHS before that, but I would say, yeah, most importantly, make sure that the questions and the areas of inquiry are in line with what people are also looking at.
Great, thank you. Michael, sorry, I'm not sure how to pronounce it. Feel free to ask your question.
Pronounced correctly. Yeah, first of all, thank you for this very insightful presentation. I wanted to know about what's happening on donor side. You know, what's the understanding, what's the position on this, and if there are any challenges, how organizations like Trust and other third-party monitoring entities should work with donors, because I assume that they might feel CHS could be additional burden, you know, when applying to OECD-DAC criteria. So what's your position about that, and how would you address it? Because I think the ideas that you presented are quite novel.
Thank you. So my personal opinion would be that an evaluation should be should reflect upon actual issues, and it doesn't really matter from which framework you are looking for inspiration. And I would expect donors to think the same. Like, I want to see something in evaluation that is actually showing performance, telling me what is the state of the work, what are the processes in place, and what kind of lessons are drawn from the experience, from the work. If you have that in your question and that your questions are in line with their areas of concerns, I don't think they would say, oh, why do you use the CHS and not the OECD-DAC criteria? I wouldn't expect that. But you're right that, as I was mentioning, people are mostly used to OECD-DAC criteria. That's a reality. So I think, we are working with the other copyright holders to try to reinforce the communities of people who know about the CHS, who use the CHS, and there are so many different ways of using it, not only evaluation, obviously. Trying to convince the donors that it's an important standard that can be used to facilitate the due diligence processes, for example. So not linked to evaluation again, but just to facilitate their understanding. And hoping that if an organization obviously is building an evaluation around this framework, they would accept it and they would see the added value. And then it's a matter of working as well. Each organization is working with the donors to explain the rationale behind, because there is a reason why we are using the CHS, for example, and not another framework. And if it's explained to the donor, I wouldn't expect them to a pushback from them, but again, that's experience who would tell us. But that's a very good question indeed.
Thank you.
Thanks.
Thank you. Umesh, please feel free to ask your question.
Yeah, thank you. Actually, I don't have a question. And thank you for the very wonderful presentation, and it's kind of eye-opener for me. As a project evaluator, I find that, I did not find the places where the people's story are to be inserted in the evaluation report. And there are many stories of change and their perception and all the people's story. There is no place for the people's story to include in the evaluation report if we are more guided from the OECD guideline. And I have been talking about this for for a longer, but with many organizations, and this is always the issue for me. And now I'm really happy to find that there is a possibility that people's story can be integrated, and then we may adapt some of the element from the CHS to ensure that people's voice, people's sentiment, people's perception is well reflected in the evaluation report, and I'm really happy to know this. And one thing, is are this group is are you going to kind of do lobby or a sort of do some sort of the advocacy on behalf of this CHS evaluation modality, and if you are going to write something about this or something so that you, in order to ensure that many people or the development organization know this. So if you are doing something like that, I'm really happy to contribute from my side in form of writing or in form of speaking or something like that. I'm really happy to be part of this
Okay.
meeting.
Thank you very much for your comments and for your interest. We don't necessarily plan to do advocacy around that, although like here, for example, I'm coming with great pleasure and share some messages and have a discussion with other people, and that's great. We don't do that very often, but what we do is that we have a yearly training on how to conduct evaluations, and all the stages that we are seeing with the different tools and processes and so on are based on the CHS. So that's something we do on a yearly basis, yes. So from Group URD's perspective. And then, yes, we are working with other copyright holders to actually spread the message around the CHS, spread the awareness towards all kind of stakeholders, including the donors, to explain basically what is the CHS about, how we can use it, and so on. We are revising the quality compass, so hopefully at some point we'll have a revised tool that is providing inputs, insights on how to use the CHS in different ways of working, including evaluation. But yeah, no, that's mostly what we are doing. No, there is no strong focus, let's say, on advocacy. But we are seeking for contributions, most likely for the revision of the quality compass. So I don't know, I guess we'll open perhaps a call for interest on our website and through our newsletter. So if some of you want to follow up on our updates and activities and be part of some work at some point that should happen in 2025, you can just register to our newsletter, follow up on our websites, and keep in touch.
Great. Maybe I'll just make a note to it. Maybe we can share that in the follow-up email, so people have, like, you will get access to these links and stuff. And in relation to this, Samantha shared, I just wanted to flag that it was shared link to information about donors' recognition of the CHS. So
yes, thank you very much. HCAI is actually the organization which is conducting the verification audits. So they are external to the copyright holders, but they are mandated to conduct all these verification audits and external processes, external verifications. So you have more information on that link, yes.
Great. Yeah, so you can find it in the chat if you do want to visit it. I think we have one last question in the chat we didn't address. A lot of thank yous for the presentation in addition to that. It's whether CHS accounts for sufficient flexibility for evaluations during humanitarian crises, when the need for rapid response often results in less accountability to affected population.
Yeah, I love that question. I would say yes, even more. When we speak about emergency context, what we want to see is that, do we make an impact on people's lives? That's what matters. We don't think about sustainability. We don't think about impact. We don't think about, the way the resources were used. I mean, that's important as well, but we want to see if we made an impact on people's life, if we alleviate some suffering from on those communities. So I would say yes, definitely. Then it's a matter of how you conduct your evaluation, no matter whether it's CHS or another framework. If it's in humanitarian crisis where you have where you don't have much time, you can decide to focus your evaluation on 1, 2, 3 core aspects of your work, and taking people's perspective into consideration into that work can definitely be very insightful, very interesting, and help you to manage a project, to adapt your project afterwards. And then, yes, could be CHS, could be another one. The good thing about CHS is that the focus will be put on people perspectives from the very beginning, from the way you interpret it into the evaluation, which obviously makes sense if you have access to people. But like, I can just share an example of an evaluation we are conducting right now in Gaza. Gaza is obviously not necessarily an easy place to work and to conduct evaluation, and still we are working with the evaluation, with the CHS as a background for the evaluation framework, and that helped to define the questions and to work to define the scope of the work. So yes, that works and that's possible.
Right. Thank you so much. I think we addressed all questions in the chat, so still feel free for these minutes to add anything if any questions come to mind, or to raise your hands. But yeah, in the meantime, I just wanted to thank Charlie, our speaker, for, I think everyone can agree, was a very insightful and very deep analysis of the CHS, which was, I think, very, very useful. As we've been in the meeting for an hour, 20 minutes, maybe we can call it here. And thank you also everyone to come up with comments and questions. It's always so great to have these conversations in a way that also makes you think about things that you wouldn't have asked yourself, but are actually also useful to you. So I think it's always amazing to have interactive conversations. Yeah, any last questions or thoughts? Yeah, other thank yous in the chat. And again, I will share on Friday, you will receive a follow-up email with the links we have talked about, the recording of this session, so you can go back and see what is useful to you.
Yeah, with great pleasure to share some resources. Yeah, definitely.
Amazing. Thank you all so much.
Thank you very much. Thank you
all.
all.
Wishing you all a great week.
You too.
Thank you. Bye-bye.
Thank you.
Thank you. Bye.
Thanks. Bye.